a lot of people come up with the phrase that the best kept secret in town. Well, oftentimes when they come up with the phrase, the information is not a secret. It's just that people don't know. It's not that people should know or people can't find out that for some reason, that information is not imparted to the community to the extent that it should be. So today, I'm not going to say that this is the best kept secret in town because it's no secret. And the individuals involved in it don't want to make it a secret or keep it a secret. But it is pieces of information that we all should know about. Pieces of information that's going to help the community. Pieces of information that's going to prolong life. Pieces of information that's going to address illnesses and do all other kinds of good things. And that information is embodied in the Department of Public Health. There are different branches throughout Georgia, but we have a phenomenal branch right here in Central Georgia, headed up by Dr. Jimmie Smith. And I'm in awe, every day, quite often I learn something different about that agency. And I'm always concerned about the community, particularly health-wise, the community and me, yours truly. So I'm just in awe of all of the services and the activities and the support resources that the Department of Public Health provides. So what I decided I'd do, I'd get the man himself on the show, Dr. Jimmie Smith, who's the director of the Department of Health for this area. I'll let him introduce himself more, but I'm so happy. And then I want everybody to be conscientious about this now, because oftentimes, there's help. Sometimes people get sick. Sometimes people die. Sometimes people go broke. Sometimes people are not repaired medically, health-wise anyway, because of the lack of information. So this information that Dr. Smith will provide will assist us in many areas of life. And I can't think of anything more important than, health and being able to access resources that will help us with health problems. So at this time, ladies and gentlemen, without further ado, I present to you Dr. Jimmie Smith. Doc, I'll start out by telling us a little bit about yourself.
Sure. Well, one, I certainly appreciate the opportunity to be here today and to talk about something that I not only do, but I do it because I love it, and that is public health and public health practice. And that goes from the day a person steps onto this world until the day they leave. So I am a residency trained family physician. Was born in North Carolina, attended Johnson C. Smith University in Charlotte, a historically Black college university, Wayne State University for medical school, came to Georgia to do my residency down at Phoebe Putney Hospital in Albany. When I left there, did a medical education fellowship with the Academy of Family Physicians, because I wanted to know how medical organizations work from the inside. And I say that because to me, that's important. Decisions are made about healthcare many times in the boardroom, not the clinic room. And if you don't have someone in that boardroom fighting for the folks that many times don't have a voice in those rooms, then you're always have to deal with the decision that came out. So I wanted to be able to represent those folks in that room, and that's what led me into public health. Those previous experiences have allowed me to, about 25 years ago, to actually serve as a special assistant to our US Surgeon General at the time, Dr. David Satcher. So I got to see a very global picture of public health. And then when I finished that stint, coming back to Georgia and particularly between Central Georgia and the Atlanta metro area, to see how public health is practiced, but also to infuse the way I think it needs to be done for the betterment of our communities.
That's outstanding. So, the Department of Public Health, as I mentioned in my too long introduction, there are a lot of, it's just almost mind blowing, as it relates to the depth and breadth of the program, of the department. So, matter of fact, I'm gonna mention this quickly because I don't want us to forget, even dentistry. I understand you added dentistry. But before going into that, just talk a little bit about the overall mission and project and activities, that are available at the Department of Public Health.
Sure. Well, our mission here is kind of trifold. One, prevent disease. Two, promote health. And then the third part is we protect our Central Georgia communities. And in my responsibility, that's at 157,000 that live here in Macon-Bibb County against any kind of health threats. And that might be through education, that might be through advocacy, or working with others, because we're not a large enough unit to do this on our own. In terms of our services, certainly folks may be aware of our clinical services, where we have a team of nurses. Some are licensed practical nurses, some are registered nurses. We have nurse practitioners, so we can actually provide some primary care here on site. Certainly immunizations, communicable disease treatment. But I think what folks miss, as you mentioned earlier, we have a dental office or oral health services here on site. So we have a dental hygienist here, we have a dentist here that not only will see children, but adults, which is a change for us, having been closed for a bit during COVID. We've been able to bring those services back. We are seeing adults here, and we're one of the few providers that are also taking the Medicaid as insurance for dental services, because many places won't. But I think on top of that, we also don't need to forget what we have to do across the community. So there's no restaurant in town that anyone goes in where we haven't been there first. We have a super team of environmental health specialists that manage the over 600 restaurants in this county. They also manage all of the, what I'll call short-term events, food trucks, those kinds of things that come through. But they also handle all of our tourist accommodations. So every hotel and motel, our team is in. They also help regulate the tattoo parlors. They work extensively with animal control to handle things like rabies and Lyme disease and other things. But they're also part of our business community, because there are no large buildings built in this community unless environmental health has reviewed the plans. So there's much behind the scenes that public health is involved in that the public just doesn't know we're the ones behind there doing.
Well, that's outstanding. I've seen the report on television about, what kind of grade the restaurants get, whether, the restaurants get an A, B, C, or D, and then your department handles that, I guess is what you're saying.
We do.
You're the one who gives the grades out.
We give those grades, and most people don't realize to be an environmental health specialist, that is the one position that I can say across the state, that requires no less than a baccalaureate degree. They have a certain number of science courses that they have to take, a number of labs. They are some of the smartest people you have ever seen in terms of knowing that much about, they have to know everything from the soil and when they're taking samples to the different bacteria, viruses that can cause illnesses with food, the timelines for all of that, but then also not from a completely regulatory standpoint, but also from a teaching aspect. Our goal is to keep the public safe. And if I can do that by talking to a restaurant owner, that's what they do. The last thing we intend to do is to come in and cite folks for something that we can correct through a conversation. Right.
That's outstanding. You talked about some of those clinical services. Discuss that in a little more detail, if you would. You talked about maybe, trying to go to your facility. It's kind of like going to see your family physician,
Yes.
one family physician. Talk about those conditions under which one can come to your facility, and talk about the requirements. I mean, what kind of criteria must one meet in order to be able to be serviced by the Department of Public Health?
Okay. This may sound as a cliche, but if someone comes through the doors of the Macon-Bibb County Health Department and it's a service that we can either access or help facilitate through a referral, we will take care of that person. We certainly handle things, but I'll start with the youngest age and kind of move up pretty quickly. So child development screenings. A mom or dad may feel that their child is not developing appropriately. We have nurses here that can assess the child. They can then, if they think that the parents are on track with what they're observing, we can refer them into what we call our Children's First program, which is linked. So you have links between the county level, the district level, and the state. And in many of those referrals we make, the state is paying for those resources for parents that need them. So it may be that your child needs a speech therapist or a physical therapist. And if they qualify from a illness standpoint, as well as a financial standpoint, because we're here to try to make sure that folks don't fall through the cracks. We're supposed to be that safety net. And my job here is to make sure that that net is as tight as possible. So if a child is having developmental delays, we can refer them into a program where they can get services and bring those services to their home. We actually have 2 rooms here set up for telemedicine. So if a person has transportation issues, let's say in Washington County or Crawford County, they can get to their local health department, but they need to come here. We can set it up where we can see them where they are, or if they get to us, then pair them with a physician or a healthcare provider from one of the larger medical organizations like the Medical College of Georgia or Emory. So we do that all the time. We actually still run a sickle cell clinic here because we have folks in our community that still deal with sickle cell. We can certainly treat things, hypertension, diabetes. We have nurse practitioners here that are well equipped to manage someone with that condition. We also have a nurse practitioner here that provides prenatal care. So we have a number of women that come here for their prenatal care. We do that in concert with the OBGYN residency at Atrium so that those women know who is going to do their delivery before they ever get to the hospital. So we want that continuum of care. And then we encourage those women to bring those children back to us for immunizations. And then their hearing and vision dental screen as they start matriculating through Head Start and then into the public schools.
That's awesome. Now let me ask you this now. What are the requirements? Because we don't want to tell, somebody that they can come and have to turn them down. But I know that there are some guidelines, particularly, as it relates to insurance or not having insurance or the income or things of that nature, because there are a lot of sick people in our community, as you know, and there are a lot of people who die. I hate to be so blunt, but it is what it is, because of the lack of medical treatment and care. And I know I could just tell from your presentation that it's your mission and your department's mission for people to live and not to die needlessly. Right. And just walk me through what it takes, and then it could be stroke, and you just mentioned it, stroke, diabetes, quitting smoking, all kinds of illnesses, so walk me through as it relates to who qualifies, because my hope is that with this conversation, that Habersham and Smith gonna save some lives.
Absolutely. So, so if a person walks into the health department, one, they can certainly call us to say, hey, I think I need assistance in this area. And we have folks on the phone that are responding to the phone calls every day that can answer those questions. If it's something that one of our staff members is not sure about, then they'll go to the clinical team or they'll send it to me to respond to. The great thing about public health in this community, as it is across the state, is at this health department, we will not turn a person away based on the ability to pay. We will not do that at this health department. If it is a service that we don't have, then we're going to try our hardest to facilitate getting that person to where they need to go. If a person, we certainly see folks with insurance, but we certainly see a lot of folks without insurance. And in that case, we work on what we call a sliding fee scale. So if they're not able to afford or have an health insurance policy, let's say through their work, then what we do is base the payment on their income. So that maybe the higher the income, they may pay a few dollars more. But if a person doesn't have that income, we are not going to turn them away based on their ability to pay. So we certainly are here for the community. We encourage them to come. I ran some data last week that I shared with our nursing staff in terms of who is it that we've seen in our building in the last 8 to 9 months. And the largest group by the data for the last 8 to 9 months have been folks between the ages of 25 and 64. And our numbers were a little skewed because I also have to count our COVID work in that too. So many people came for COVID vaccines. But certainly 25 and up, of those, I would say probably only about 50% had insurance. But we work on that fee scale, which is very, very reasonable for folks to come and get care. Because you're right, we don't want to see folks die prematurely. We don't, it's a statistic we call years of potential life lost. And so that number is, if the average life expectancy in the US is 75, then if a person dies, let's say that person dies at 70, we consider that 5 years of potential life loss. Well, when that person leaves our community, as we've seen with over 600 folks with COVID, just COVID alone, those are moms and fathers and aunts and uncles and siblings and cousins. And those are resources out of the community that we really need to have in our community.
Okay, let's talk a little bit about COVID. And then once you leave that, I want you to do a reach out to individuals and entities and organizations. I want you to do an appeal to them to help you, help us familiarize the community about these services in an effort to not have so many years lost when next time you do the statistics. So we had 600 people that died from COVID for Central Georgia.
From not just from Central Georgia, just from Bibb County. So when I looked at the numbers last week, it was 618 that the number one on the death certificate, the number one line said COVID. Now I also realized there are other folks that may have passed and COVID was a contributor to that, but it wasn't necessarily listed as the primary cause of death. So someone could have had uncontrolled diabetes or hypertension, came down with COVID, and COVID contributed to their demise, but it wasn't listed as the number one cause. But that's 618 people since this pandemic had started here in this community. When you look at those numbers, you try not to compare county to county. But what I do notice when I start looking at counties of similar size, so for us, it would be Houston County. Houston County had more cases of COVID than, say, Bibb County. However, the number of deaths in Bibb County was nearly twice that of what it was in Houston County. And when you start looking at those numbers, there are lots of variables that would play into that. So maybe someone was sicker. when they came down with COVID in one county versus another. But I think it does lead us to look at the bigger picture of when you have these other conditions that are not being taken care of, even when the resources are available, it has an impact down the line. And unfortunately, COVID really shined a light on those differences.
Yeah, and then I guess essentially what you're saying is that if you've got those conditions, now more than ever, one needs to try to address those conditions and get whatever treatment that's available for them. Because if, God forbid, you contract COVID coupled with those conditions, right, then you're more likely to be in that statistics that say you lost.
Yeah, it certainly puts you at higher risk, and we still go back to those same things. Getting a vaccine.
That's what I was
making sure you follow through on the vaccine. So getting the first dose, the second dose, and then the booster when you're eligible 5 months later. Wearing a mask when you're out in public. You don't know where everyone else has been, and just that simple mask can protect you and give you that barrier. Getting a COVID test when it's appropriate. If someone says, hey, I was with you yesterday and I got my COVID results today and I'm positive, you don't necessarily need to run and go get a test that afternoon. But you need to wait 3 to 5 days because it takes a few days for the virus to multiply for it to even be able to show up. And then the other thing is social distancing yourselves. So these very large crowds and things like that, if you can avoid them, please do so for now. If you can't, then certainly wearing a mask and wearing the appropriate kind of mask and wearing it the right way. Can't have the mask on and it's covering your chin. It's got to cover your nose and your mouth. So I see folks trying to make the effort, but it's got to be the right effort. So we certainly still continue to push those. I will be the first to say in our messaging from public health, it has changed so many times through this pandemic that folks can get confused. But when you have that, sometimes it's better just to sit still and get the right information, as we're trying to do today, to say, folks, there are resources, there are places you can call. What I'll tell folks, when it comes to your health, there is no, I can't put a price tag on it. So we want you to call. We want you here because you're a contributing member of our society.
Yeah, that's outstanding. So, Doc, if you would, I just want you to kind of present a message to the community, particularly institutions and agencies and organizations, to provide some kind of assistance, but, it could be just informationally for, the services and the products and the kind of provisions that you have for people in the community. There are a lot of agencies out there, who I bet you hadn't thought about the fact that, these resources are available through your department. So if you would just chat with them for a minute.
Sure. To our Bibb County community, what I would say is, one, your health department stands here with you. We stand here for you and we stand by you. So to those, all of the organizations, agencies, and I would even say down to the individual level. One, if there are services that you're unsure about, give us a call. And if we don't have it, we will point you in the right direction. But at the same time, I am also very acknowledging that with the staff of about 45 that we have right now, trying to serve 157,000 that live here, we must do this through a partnership. So if you're an organization that is able to afford insurance for your staff members, give us a call. If it's a service that we can't offer them, maybe we can offer you the service of helping you read through your health data to see how best to serve your employees. And by that, I mean, I'm going to use Bibb County employees just as my example. There are over 1,500 Bibb County employees. They are they're given the option to sign on to insurance. But if your employees are not utilizing that insurance, that's an expense to your business that's going out where you're not reaping the benefits. So how many of those folks actually get a physical every year? And I'm gonna put this plug in, we can give the physical. We have the staff here that can do that. How many of your folks have hypertension or diabetes and needs to be managed? We can provide that service here. We are actively working to get our staff, some other additional staff members trained. I just finished a training as a diabetes lifestyle coach, so we can begin offering those courses here for our community. We can do it in person or we can do it virtually. So I've got one more person that's going to the class, and hopefully by the summer, we will be able to offer that to the community. To our, particularly since women are the #1 user of public health services, certainly we want to make sure that we prevent disease, in your case, cervical cancer, breast cancer. We have a program called the Breast and Cervical Cancer Screening Program, where if a young lady over the age of 40 has no insurance, they can come to us, get the breast exam done here, and then we can put them in a program where we will pay for the mammogram. So breast cancer ought not continue terrorizing our families due to income. We do know that in terms of health, again, we can't do this alone. And one of the biggest contributors to health is what we call our social determinants of health. Many times those other things, as you mentioned earlier, get put before coming in for the visit. School, job, environment, social networks. When we can improve those, then we improve health. Health is not a zero-sum game. We don't take something away from one person to bring another person up. But when we do our best to protect the health of those most vulnerable, the health status of the entire community rises. So to our individuals, our agencies, our organizations, I would ask you to continue, because many of them are still partner with us. Today is Monday. On Friday, we're meeting with the leadership team of the Department of Family and Children Services to see how we can coordinate our efforts and better serve parts of the community. We're working with Mercer University and its undergrad students right now to develop podcasts about 10 different focuses of public health practice. We're working with Central Georgia Tech to see how we can get their dental hygiene students to also practice their craft here. We've been in communication with the Dental College of Georgia because we only have one dental school left in the state. Starting next month, they're going to be sending students to Macon-Bibb County to take care of patients here under the tutelage of our dentists. So we're out there making those continued partnerships. We want to serve as many people as we can here. The county commissioners have gone above and beyond the formula of funds that they have to contribute by state regulation. They send additional monies to make sure that folks in Bibb County are taken care of. And we want to do that work.
That is outstanding. So how about giving the contact information in the event that a person wants to call, or if they want to go and view the website, because it's a phenomenal website. I went to the state's website, and I guess it parallels with what's, with the county, but I'm serious. Everybody needs to go to just be familiar with all of those services and products that the health department provides. So how does one get in touch?
Sure. So if they want to get in touch with us, one, keep in mind, we did change locations about 6-7 months ago. So we're now located at 1600 Forsyth Street. That's in Macon, and the area zip code is 31201. So we're now located at 1600 Forsyth Street. So if you're coming off of 75 and headed to the hospital, we're the second building on the right side. Our phone number, 478-745-0411.
That is so outstanding. Well, I want to express my appreciation to you. I know you're about to get on the road and headed to North Carolina, and let me say this, I'm going to say this publicly, and you didn't ask for this. You're doing an outstanding job. I've been living long enough to know, I can tell when somebody's heart is in it. When they're doing it for the money, or when they're doing it just for the money, or when they're doing it because they believe in what they are doing. And that's written all over you, Doc. And I really appreciate it, man. It means a lot to me. I'm sure that it means a lot to the other listeners and viewers on this program and the other partners that you just talked about. So keep up the good work.
Yes, sir.
Don't be reluctant to call on me or any of the other agencies. If I can help you hit somebody over the head, with a feather, I'll do that also, but continue to do this. I am Alex Haversham, your host for A Call to Action, having interviewed Dr. Jimmie Smith, MD. Is it just MD or is it some other titles after that, Doc?
It's MD and MPH, a Master's in Public Health.
Okay, MD, MPH, who's the director of the Department of Public Health for Bibb County. Thanks again, Dr. Smith. We really appreciate you and keep up the good work. I'm your host, Alex Haversham. Have a great day.
www.maconblackpages.com